Are you currently experiencing one of these two parenting styles? The reactive style, feeding and soothing the baby whenever they cry, leading to parental exhaustion and a lack of routine for the child. The rigid style, trying to force the baby to eat and sleep according to a strict, fixed schedule. Both approaches often result in parental burnout and a feeling of restriction for the baby. In 2001, British pediatric nurse Tracy Hogg created the easy method to help infants establish a stable routine, eat well, and sleep on time without feeling constrained, making the parenting journey much smoother. This method is rooted in the belief that infants, even before they can speak, constantly send clear signals about their physical and emotional needs through cries and body language. Family chaos often stems from adults misinterpreting these signals, such as feeding a baby when they are actually sleepy or trying to put them to sleep when they are hungry. Easy provides a framework for parents to observe and understand their child better. Reducing stress for everyone. Establishing a circadian rhythm is a complex biological process. Newborns have no concept of day and night. Easy supports this by repeating a consistent sequence of activities. When a child knows that after waking they will eat, after eating they will play, and when tired they will sleep, they develop a sense of security and confidence. This predictability is the foundation of trust. The child learns that their needs will be met consistently. Reducing anxiety and unexplained fussiness. A detailed breakdown of the easy components. Eat, the energy refueling phase. The first activity immediately after waking is eating. Feeding at this time serves two core purposes: ensuring the baby is at their most alert, making the feed more efficient, and, more importantly, completely separating eating from sleeping. In traditional parenting, babies are often nursed to sleep. This accidentally creates a sleep association, where the baby cannot fall asleep without a breast or a bottle. Easy breaks this dependency by placing the activity phase between eat and sleep. Duration: usually 20 to 45 minutes. Goal: focus on a full feed rather than snacking throughout the day. A full stomach allows the digestive system to rest and provides enough energy for a long daytime nap. Activity, physical and sensory development. After a thorough burping, the baby enters the activity phase. This is their time to interact with the world. For newborns, activities don't need to be complex. They can include diaper changes, hygiene, massages, or simply observing their surroundings. Tummy time is highly recommended to help develop neck and shoulder muscles for future milestones like rolling and crawling. Note: pay close attention to the baby's wake window to avoid overstimulation, which can lead to overtiredness and difficulty falling asleep. Sleep, the neural recovery phase. When the baby shows signs of tiredness, parents perform a sleep routine to settle them. Easy encourages learning self-soothing skills without excessive intervention like rocking or strolling. Quality daytime sleep supports brain development and memory consolidation. Sleep cycles. A typical newborn cycle lasts about 45 minutes. Waking up after one cycle, a catnap, is common. Easy provides tools to help babies learn to connect these cycles for longer stretches. Your time, recharging for parents. While the baby sleeps, the mother has time for herself, to rest, practice self-care, or handle personal tasks. This predictable downtime is vital in reducing the risk of postpartum depression and caregiver burnout. A well-rested parent is in a much better headspace to interact with and understand their child in the next cycle. Pro tip: do not force the baby to follow the clock to the exact minute. Easy is a flexible sequence. If the baby wakes up later than expected, the entire eat activity sleep sequence shifts accordingly, but the order remains the same. Tools and techniques to support independent sleep. The slow rule, the art of interpreting cries. Instead of rushing to soothe the baby immediately, use SLOW to understand their true needs. S. Stop. Pause for a moment to observe instead of rushing in. L. Listen. Listen to the tone of the cry. A hunger cry is often sharp, while a tired cry is usually more of a rhythmic whimper. O. Observe. Look for physical cues like rubbing eyes, turning away, or sucking on hands. W. What's up? Use the easy schedule to guess what the baby needs. Is it time to eat, sleep, or a diaper change? The pause. The pause is simply a few minutes where you freeze and observe when the baby fusses. Rather than intervening instantly, this gives the baby a chance to self-settle and connect sleep cycles without becoming dependent on being held, nursed, or rocked. The wait time increases as the baby grows and their sleep skills improve. Please refer to the table below for the ideal timing guide based on your baby's specific developmental stages. The 4S sleep routine. To help the baby drift off peacefully, Tracy Hogg suggests the 4S routine. S1. Setting the stage, dimming lights, closing curtains. S2. Swaddling, providing a sense of security. S3. Sitting quietly, co-regulating with the baby. S4. Shush pat, gently shushing and patting the baby to reassure them when placed in the crib. Troubleshooting common easy issues. 1. Cap nap. If a baby wakes after 30 to 45 minutes, try the wake to sleep technique. Enter the room 5 to 10 minutes before their usual waking time and gently touch or stroke them so they move slightly but don't wake up. This resets the sleep cycle. 2. Wonder weeks. These are leaps in cognitive development that can cause fussiness and sleep disruptions. Be flexible and offer more comfort during these times, but try to maintain the core routine. 3. Early morning REM and early morning awakening. Waking at 4 to 5 a.m. is often due to low sleep pressure or environmental changes. Keep the room pitch black and use white noise to help them sleep until the official wake time. Creating an optimal sleep environment. Position. Always place the baby on their back on a firm, flat surface. Keep the crib free of pillows, blankets, or toys to prevent suffocation. Lighting. The room should be completely dark. Even a small light can wake a baby during a sleep cycle transition. White noise. This masks environmental sounds and creates a stable, sound blanket. Temperature. While Western standards often suggest cooler rooms, in Vietnam's tropical climate, the recommended range is 26 to 28 degrees Celsius for babies under 2 months and 24 to 26 degrees Celsius for those 2 to 12 months. The core check. To see if a baby is too hot. Don't check their hands or feet. Instead, touch their chest, back, or nape of the neck. If the skin is warm and dry, the temperature is ideal. If they are sweaty or red-cheeked, they are too hot. We hope these insights help you feel more confident in applying easy. The combination of a scientific routine and deep parental love will create a solid foundation for your child's physical and intellectual growth in their early years.